After a year-long contentious debate and still now during continuing controversy, many Americans are trying to get a handle on what the health care reform bill means to them.
Using 22 pens to be handed out as souvenirs, President Obama signed historic health care reform legislation into law.
I'm signing this reform bill into law on behalf of my mother, who argued with insurance companies even as she battled cancer in her final days.
It was personal for him, but also political. Throughout a heated year-long debate over the issue, sharply divided along party lines, the president didn't back down.
We as a people do not shrink from a challenge, we overcome it.
Starting this year, the bill would allow tens of thousands of Americans who have pre-existing conditions or who were dropped by their insurers after getting sick to purchase coverage. And small businesses would also start getting tax credits to help cover their employees.
Joining us now to talk more about the bill's changes is Brenda Kelley. She's AARP's state director. Brenda, thanks for being here.
Thank you for inviting me.
Yes, well, tell us, first of all, what your group's position is, has been. Did it take some convincing for you to get on board with the health care reform bill or not?
Actually, AARP has been around for about 50 years, and we were founded really by a retired teacher that found a former colleague of hers living in a chicken coop, because back in those days teachers could not get health insurance. Older people couldn't get health insurance. It was pre-Medicare.
Okay.
And so really
50 years ago?
50 years ago. Wow. Medicare didn't come about until I was actually in high school. Mm-hmm. And so AARP has always had as top of our agenda health and long-term care. And I think AARP, like many aging organizations and a lot of different groups, a growing consensus was that we needed to do something. You know, that we were at a point that the cost of health care was becoming so great, and that there was the growing number of uninsured and underinsured, that we've been really hoping for this for several years, actually. Mm-hmm. And we were one of the organizations that got on board pretty quickly, but not necessarily in support of a particular bill. I mean, we were there, and it's always our reason for being there, to look out for the interests of our members.
So you were interested more in the general idea of extending health care?
Absolutely. And we have a public policy institute, and we had some opinions as to what would work. But it wasn't like we came in and said, whatever you do, we'll sign on to.
Right.
We were there making certain that the interests of our members and older people 50 plus, were really adhered to in the health reform bill.
In what ways do you think that the bill does satisfy those needs?
Well, I think it does a lot, incredible lot. I'll start with the people 65 plus, the people on Medicare. Mm-hmm. Our first goal was to make sure that they did not lose any of the guaranteed benefits that they have been paying for so many years through their payroll deduction. And I'm happy to say that there are no losses in benefits whatsoever. And there's actually a clause in the Senate bill that passed that makes it clear that there cannot be a reduction in benefits. But beyond that, our members were very concerned about the high cost of prescription drugs and this infamous donut hole,
right.
Which is a coverage gap in Medicare. So we made that one of our top priorities, and we're pleased to say that this year, as a result of the bill passing and being signed into law, that everyone that enters that donut hole will get $250 to help defray some of the costs.
So explain what that donut hole is for people who don't know.
What it is that under the Medicare Part D prescription drug program, you pay up to 25% of the cost of your drugs until you get to a certain level of cost. And then you have to pay the next $3,000
right.
totally, all right, while you're still paying your premiums. And then you get into what is called catastrophic coverage, where you get really good coverage. Mm-hmm. But in that donut hole, you're paying the whole cost, and you're also having to pay your monthly premium. So it's quite burdensome. And about 25% of the seniors in Connecticut fall into the donut hole at some point during the year.
So this closes that gap.
The first year, this year, it's going to be $250. Next year, there will be a 50% cut in the cost of brand name drugs for people in the donut hole. And then it gets better and better until 2020, when it's totally closed and people pay 25% of their cost of the drug until they get to the catastrophic level, and there is no donut hole.
Was it difficult for you to get this message and to get seniors in Connecticut, I'm thinking in nursing homes, to understand and to not fall prey to some of the suggestions about what the health care reform bill would be, particularly for citizens? There was that horrible suggestion that there would be the, that they would put you to death,
right?
Right?
Right. Well, for the most part, yes. I mean, it was a difficult thing because I think that seniors vote at a much greater rate than younger people. And also Medicare was a big issue. So they were the target of some really bad misinformation and distortions. And yes, that did confuse things. But
so how did you counter that?
We did a number of town hall meetings where we went out and we called them community conversations. We actually held teletown hall meetings where we called people and we would invite the congressman in to talk about what was going on, and they would be on the telephone, and we reached a lot of people that way.
Excellent.
And we also formed a partnership with other senior organizations, and I think a lot of people don't understand that almost every credible senior organization in America is in support of this bill.
Right.
And so we joined with 21 other national organizations, and it was called Seniors to Seniors, and we did some events to get the word out that this was not what it was being portrayed as being.
And you probably still have work doing that.
Oh, absolutely, because we're in the educational phase of this bill. There's one other thing that the people on Medicare are going to benefit from, and that is that there will be free preventive care. Starting next year, number one, they'll get an annual physical. They don't get that now in Medicare. And also any preventive care like a colostomy or a mammogram, there will be no co-pays for any of that. So that's another huge benefit.
Right.
Do you want me to talk about the people that are younger than on Medicare? I don't want to.
Yeah, that'd be great. I don't know how much we have, not much time, but a minute and a half.
Yeah. Our members are 50 plus.
Right.
And the biggest problem with people in 50 to 65, if they lose their job, they lose their health insurance.
Right.
So there are provisions in this bill, of course, for an exchange where people are going to be able to get insurance. But also, there's going to be a prohibition about charging older people significantly more than younger people for insurance, which has been a big barrier for people in that age group.
Right.
And starting in 2014, when the insurance exchange is open, you're not going to be able to deny someone coverage because of a pre-existing condition. And then there's also, and I doubt that if you have a minute and a half I have time to tell you about this, but I'd love to come back at some point. There's tremendous benefits in this bill for long-term care. You mentioned people in nursing homes. Most of the people don't want to be in nursing homes. And there are provisions in this bill that are going to allow people to stay in their homes and communities. And I think they're some of the most exciting but not well understood parts of the bill.
Right. Well, we will have to have you back to talk about that because that sounds like very good news. All of those points sound like good news for our seniors here in Connecticut. Yeah. Thank you, Brenda, so much for coming. Brenda Kelley, AARP's State Director. Don't forget, if you missed something here on The Real Story, you can now watch it online by going to fox61.com. You can also catch us on YouTube. And we also have a Facebook page. If you have ideas, please email us. Thanks for watching this week's edition of The Real Story. We'll see you here again next week.